Welcome everyone to the COVID-19 update on Channels Television. The highlights: Enugu Governor and Deputy complete full dose of COVID-19 vaccine as states expand vaccination sites to ensure completion of AstraZeneca vaccination. Enugu State Primary Healthcare Development Agency, in collaboration with United Children's Fund, organised retreat for newly elected local government chairman on infectious diseases. And India reports over 70,000 new infections, its lowest number since 31st of March, down from a peak of about 400,000 daily cases in May. The COVID-19 pandemic has had an important effect on the way national authorities and donor associations manage blood donations. Today, Nigeria joins the rest of the world to mark the 2021 World Blood Donor Day, with the Nigerian Medical Association (NMA) advocating the need for adequate legislation that will guide blood transfusion medicine in the country. Addressing a news conference in Abuja, the president of the NMA notes that the lack of proper regulation makes quackery in transfusion medicine to thrive in Nigeria, thereby increasing the risks of transmissible infections among blood recipients.
Welcome to the press conference.
There is a yawning gap between the WHO recommended annual blood requirement for Nigeria, which is 2 million units, and at the moment we get a paltry number of about 1 million. It's probably more, sometimes more than less than 1 million. When you do the screening, find that some are infected with HIV, others hepatitis, and other blood infected products. Now we observe that NBC National Blood Transfusion Centers are poorly funded and in their need of upgrade in terms of manpower, infrastructure, equipment, and training. There is urgent need for all stakeholders in government and in the health sector to join hands and push for speedy passage of National Blood Service Commission Bill and assent by Mr. President.
Let's now bring you the COVID-19 situation report.
The third week in June begins with low figures of new coronavirus infections, with only 7 samples confirmed positive in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 3 states, including Lagos, Kwara, which recorded 3 cases, while Rivers recorded 1. The agency also reported 0 cases from Plateau, Nasarawa, Kano, Imo, and Sokoto states. Nigeria now has a total of 167,000 confirmed COVID-19 cases. There were no new deaths from COVID-19 complications, leaving the fatality toll at 2,117. 27 patients have been discharged in the last 24 hours after testing negative to the virus, including 31 community recoveries from Lagos State, managed in line with the NCDC guidelines. The total number of recoveries now stands at 163,463. Almost 2 million eligible Nigerians have been vaccinated with the first dose of the Oxford AstraZeneca vaccine, while more than 639,000 of those vaccinated with the first dose have now received their second dose. In the second phase of the exercise, Lagos State is taking the lead after vaccinating over 118,000 of its largest population, followed by Oyo and the FCT. In Africa, there are now over 5 million confirmed cases of COVID-19 and more than 134,000 deaths on the continent. Globally, more than 175 million confirmed cases and over 3.8 million deaths have been reported from several countries.
The Enugu State Governor Ifeanyi and his deputy Cecilia Ezilo have received the second dose of the AstraZeneca COVID-19 vaccine. The event was coordinated by the Executive Secretary of the state's Primary Healthcare Development Agency. Speaking to journalists after the inoculation, Dr. George Ugu said that over 5,000 persons out of the 30,000 who received the first jabs have already taken the full dose.
The last couple of days, we've covered about 5,000 citizens in the second dose, and we're moving on and on. If you look well, you can see that the number of cases that are coming up from our state is getting down, and it's due to this effective fight. We are all out. This is only the beginning, the first phase, second dose. We're using this opportunity to ask all our people. We've made public designated area, the designated health centers. This is going on in all the 17 local government areas, in our primary healthcare centers. People should kindly come out, complete the process of being protected against this deadly illness.
Meanwhile, in Delta State, over 900 persons have been fully vaccinated. This is according to the governor, Ifeanyi Okowa, who also disclosed that all the required doses are delivered to the state, and more health officials would be deployed to as many more places as possible to carry out the vaccination program. The governor also hinted that more doses of the vaccine is set to arrive the state for onward distribution to residents. Dr. Okowa was speaking to journalists after inspecting facilities at the Asaba Specialist Hospital.
Only 4 million doses have come into the country, and I do believe that that meant that we're going to have about 2 million people vaccinated because it's the first and second dose of the AstraZeneca vaccine. So I do believe that when we have all the required doses, they'll go to as many places that they feel they have to come into. The PS has just told them that they've just done vaccination for about 910 people, but the real truth is that the numbers change by the day. That is for the purpose of possible the second dose is being given. As to when the next set of doses for those who are going to have be freshly vaccinated with the first dose, there's going to be a waiting period. In July, we're expecting some vaccines, more likely the Pfizer vaccine, but in September, we'll be expecting the Johnson & Johnson vaccine. And I believe that when more of that come, many more Nigerians will be vaccinated.
The spread and impact of COVID-19 have been quite diverse across countries. This has been affected by the performance of political and economic institutions, causing people to question the ability of liberal democracies to protect their citizens. According to a group of scientists using a number of variables, democratic countries may react slowly in the short term, but place a higher value on human life and health under the pandemic. Well, to talk more about this is Dr. Jonathan Dangana. He's a lecturer at Babcock University, Department of Public Health, Technical Advisor, Africa Health Agenda. He joins us here in Lagos. Thank you for joining us on the program.
Yes, thank you, Millicent.
All right, what's your take? I mean, are globalization levels of countries positively related to the spread of COVID-19 in terms of speed and then the scale?
Thank you for that question. And to be very precise, I will say yes. You will see that globalization, as the case may be, if you want to look at it from a basic perspective, you know, you look at trade, you look at investment, you look at finances, you look at ICT, as the case may be, and you find this more, you know, very prominent in Western countries. And if you want to take quick statistics, you will realize that the US, and by extension Europe, is where you find, you know, a huge chunk of the scary figures that we have seen as far as COVID-19 is concerned. And then you will see that even in the US itself as a country, the soaring figures of that country alone is almost double what you find in collectively the whole of Europe. But then the beauty is that you will see that human mobility is actually a key factor. So if you want to look at it in terms of speed, yes, you will say that is. For instance, Italy at a point was giving us globally a very scary figure for us to be able to understand what this COVID-19 was all about. But interestingly, you will see that the figures show that in Italy alone, between 2020, 10 years earlier, Italy has recorded almost the total population of Nigeria as a country, as number of mobility of persons in and out of the country. So you will see that human mobility is actually a key factor to see, you know, the spread of COVID-19. And that is why governments of different countries, whether in Europe, that is whether in globalized country, or you come down to developing countries in Africa, have equally spoken about, you know, lockdown, stay back, is to minimize human mobility so that the dynamics of this spread can actually be curtailed among human population.
And talking about the dynamics, some believe that maybe more autocratic governments, they put it, have been able to act faster and stronger in taking decisions to protect their population. But, I mean, what would you say is the one thing that Nigeria handled well?
So, interestingly, you know, this autocratic, you know, society, as the case may be, you may be tempted to even feel that they don't even exist, because today I am not sure that if you are talking about the issue of COVID-19, the country like South Korea is one of the places that comes to your mind, or even Saudi Arabia is one of the places that comes to your mind. But you always want to talk about Europe, America, as the case may be. But then you may also be tempted to feel that, you know, this issue of COVID, you know, it didn't have a stake in those countries. But be that as it may, available data didn't show anything to say, you know, that there was no huge spread, as the case may be. But of course, there is information to say, yes, this ailment have gotten to these countries, but maybe the magnitude to which they have been able to manage information is key to why things are that way. And just to respond very quickly to the last question, you know, to the question you talked about of what Nigeria has been able to do appropriately. I think that as a country, what we have been able to do in managing human mobility is laudable. It's arguably to say that it was not done properly, but give kudos. And sometimes as Nigerians, there is the temptation that when you speak well of what government does, you may be perceived as somebody who is getting something from government. But give government what she has done well. And of course, even the issue of making vaccine available, I think it's also a laudable process. If you come down to Enugu State as an example, and maybe more specific in Babcock University, you know, where my primary assignment is, the issue of vaccine has been a very smooth one. Individuals who have presented themselves to that facility have been able to get vaccinated. And I'm sure the university and her leadership, you know, didn't go to sleep. They had to make sure that their own path in making things work.
All right, let's take a look at how COVID-19 affected democracy across the world. In a few places, elections were postponed or cancelled. At least 78 countries, yet at least 88 countries managed to hold national elections. This is despite the cases. Countries like South Korea quickly adapted their electoral processes to pandemic conditions. We understand that in Burundi, the first competitive presidential elections since 1993 were held, but quarantine restrictions due to the virus meant that international election observers were not present. And we had the global citizens' protest across, a dramatic wave of citizens' protests. And interestingly, Nigeria had its fair share as well. So essentially, Dr. Dangana, as we wrap up, we've not been left out in some of the effect of the pandemic. How do we build back democratically and also ensure that we put an end to this pandemic and are prepared for future pandemics?
Thank you very much. You see, very clearly you said, you know, we were not exempted in the narrative, you know, in terms of human reaction to various activities of government. We had our own share of even the just concluded or the ongoing, you know, public holiday. We heard of issues of places that have happened, you know, demonstration as the case may be. But that's not the primary focus here. What do we need to do? I think, in my opinion, government needs to step up her activity. COVID-19 has brought a new reality for us to understand where our stakes are, where our problems lie. We have a failed system. And I think that is a first step to look at. Examine your system clearly. Where are the loopholes? What do we need to do? Let us be patient, focused. Okay? And then the next point is, think about your workforce. How do you, you know, take care of them? Because many of us are suffering from burnout. Why? Because there is also a shortage of manpower. And so when you look at these loopholes, I think these are first steps that government can take. And then, of course, there is nothing wrong in rejigging the system. But that's a different discussion on its own. But these are issues that need to be looked upon.
Indeed. We appreciate your time. Thank you so much.
Thank you very
Dr.
much.
Jonathan Dangana, lecturer, Babcock, Department of Public Health. Thank you for joining us on the program.
Thank you.
Still ahead, diseases, surveillance, COVID-19 and community engagement strategy is explored in Enugu State. We have that in a moment. Welcome back. In an effort to mitigate the challenges of the coronavirus pandemic and some killer diseases, the Enugu State Primary Healthcare Management Agency, in collaboration with United Children's Fund, have organized a 2-day retreat for the newly elected local government chairman in the state. The Commissioner for Health, represented by the Permanent Secretary of the Ministry, charged the chairman to key into the policies of government through awareness creation so as to keep their wards abreast of any disease outbreak.
LG chairmen are our key stakeholders in the implementation of primary care. So we want them to support us in all the activities that we are undertaking at the state level. So they are the people that are custodian of the human resources at the grassroots, at the operational level. So we need their support and intervention, especially the issue of participation in supervision, daily review meetings. These are very critical and they are key component of primary care, especially as far as the Abuja commitment. COVID-19 is part of it, but other components of primary care are generally being discussed.
And we know the important role that the local governments play in healthcare service delivery, especially in the level of primary healthcare services. And being the agency of government saddled with the responsibility of ensuring adequate provision of primary healthcare services across the state, we felt there's need for us to actually organize this retreat to interface with the local government chairmen for us to update them on what are the state priorities in terms of primary health care services, and then especially also our integrated primary health care development plan for the state, and get their buy-in. Also to highlight the responsibilities of the local governments and what roles they can play.
And at the moment, Prime Minister Boris Johnson is setting out a 4-week delayed lifting of all restrictions beyond the 21st of June. Businesses are expressing fears and also about heavy losses. We understand that the clubbing trade body is threatening legal action as the easing of England lockdown is delayed. Well, joining us on the program from Cambridge in the United Kingdom is Mr. Doherty. He's a COVID-19 survivor and also a project management consultant, global labor and social change advocate. Thank you for joining us on the program.
Thank you, Millicent, for having me on this program.
Briefly tell us about finding out that you had COVID-19 and the quarantine experience.
It was very awful, terrifying, just as if it's time for one to get out of this world. It's not an experience that is that should be wished to one's enemy. It was very awful, I must tell you, terrifying, and in fact, just being grateful to God and the proactiveness of the government of United Kingdom to handle the pandemic at its incubation period.
So now you've passed that, you're free from COVID-19. I also understand that you recently arrived the UK and you were isolated. Share with us that experience.
Thankfully, I was grateful that I passed through the pandemic with the United Kingdom government proactiveness in rolling out tests. And rolling out testing, and they were able to cope at least further spread. If you look at the population of death and infections, you know UK had its own full length of the COVID infection. But thereafter, there was serious consideration, serious research that went forward thereafter, which at the end of the day provides us with a remedy in the name of the vaccine, the COVID vaccine that we have developed in Oxford here in the UK. And when it was rolled out, there was a very good planning to making sure that every citizen got his first dose and second dose of the vaccine. And I'm grateful that I had the first dose and the second dose. So that gave me an assurance that yes, I can travel. and my head got back to normal. So with that, I was happy, and I recovered my energy back. So therefore, I traveled. Even though the government has rules in place, the traffic light rules, as we know, the green, amber, and red. Fortunately, I would say unfortunately or fortunately, I traveled to a red country, which surprisingly they had a very good model of restriction where they manage traffic, they manage human relationship, they manage the washing of hands, sanitizing your hand, nose covering your nose, and social distancing, which really worked well in the country that I visited. And I returned back to the UK, and I would say I paid the price. But even though returning back to UK, paying the price, there are still reasonably enough government requirements. I was a little bit disappointed in the implementation process of the red rules, which culminate with delayed clearance at the airport when you get back to the UK, and the security apparatus, they were not organized, and you get to the hotel where you quarantine, you've been treated like a plague, even though as a resident there are supposed to be what we call discretion. There's supposed to be a waiver to rules if you have gone through those processes, because before you travel you have to undertake a PCR test. Where before you return back, you undertake a PCR test. Why in quarantine you do 2 PCR tests? At the end of the day, all these things were clear, and we returned back home just a day ago, yesterday Sunday. But it was good implementing rules, but sometimes too you must be reasonable while implementing the rules, looking at the fact that the citizen has fulfilled the obligation of government in terms of obedience to such rules.
So I'm sure you're definitely one of those who are really looking forward to Freedom Day in the UK.
Yeah, definitely.
Right.
But you know, the other thing now is that the government is going forward to further delay the June 21 lift the restriction. But what you won't blame the government. Currently, we know the variant. We have the Delta variant, which emanates from the Indian variant, and I can tell you that it's really spreading here in the UK, especially in some areas that is not far from where I am, Central Bedfordshire. So we have to be careful. Even as at that too, when you're careful, we must realize the fact that we are going to be living with this disease. The only thing we pray is that research that are ongoing should be able to give us on the counter drugs that we can use if we have a feeling of the infection.
All right, Mr. Tunde Doherty, we appreciate your time. Thank you so much for sharing your experience with us on the program. Many thanks.
It's my pleasure. Thank you very much for having me.
And yes, still more updates there that from the UK, more than 60 million have indeed been vaccinated against the coronavirus, and the numbers keep increasing. Well, according to new research in the United Kingdom as well, headache, sore throat, runny nose are now the most commonly reported symptoms linked to COVID-19 infection. Remember, continue to take responsibility to protect others if you are experiencing symptoms linked with COVID-19. You can visit our website, it's channelstv.com, for more updates, also a better understanding of the pandemic. You have many stories there from politics, business and sports. It's all at your fingertips. That's the program this evening. Thank you for watching. I'm Millicent Mwaka. Stay healthy.